What's up, C Money fam, and welcome to another edition of Nursing in Flow. Today's episode will be part 2 from my previous episode, which I talked about how to manage strokes from a hospital setting, with the focus of this episode being more so along the lines of what to expect after that initial hospital discharge. Welcome to the episode. So guys, one of the biggest requests that I got from my previous episode was what to do after that initial hospital discharge. Because sure enough, while I talked about what to expect at the hospital setting, there is a whole variety of aspects that you need to consider once you get home from the hospital. There's a lot of therapies, there's a lot of management involved, and most importantly, it's very stressful to not just the patient, but also the family itself. So I wanted to shed some light and provide a resource on ways to manage this altogether. So here it goes. Just a disclaimer, I got permission from my loved one who had undergone the stroke and the family. So all of these pictures, these videos that I will be presenting to you in today's episode, I've gotten with permission. And I believe that with storytelling, it helps provide another aspect of nursing. It helps with understanding, from a different patient's perspective, and also kind of just gives an example, a real life scenario of sorts. So here it goes. So guys, this is a picture of my Lola Lina, and in case you don't know, in Filipino culture, we refer to our elders with our grandmothers being Lola and our grandfathers being Lolo, so I call her my Lola Lina. It was just a regular day. She was in the kitchen cooking, and when she least expected it, she started to slump over. Now luckily, my Lolo Piping, my grandfather, he was at the kitchen at the time, noticed she was about to slump over to the floor, and assisted her in a slow fashion. What ended up happening after is that my Lolo had a difficult time with getting her up, so he ended up having to rush over to his neighbor and get some help with getting her up. And both of them had a really difficult time getting her up. It was very hard for them, so what they ended up doing was they called 911. 911 arrived, they rushed her to the nearest urgent clinic, they did a CAT scan of the head, and it turned out she had a massive brain bleed. Because of the severity of the issue, she was actually airlifted from the urgent clinic to the nearest hospital, in which she was treated immediately. Luckily for her, she didn't suffer too much. She did suffer a left-sided deficit, which means she had some weakness and lack of strength and mobility on the left side. But other than that, her speech wasn't impaired, her facial and her movements weren't impaired. She was fine after that. So she stayed in the hospital setting for about 2 weeks, and she worked extensively with the physician. She got in medicines. She worked with the occupational therapist, the physical therapist, and speech therapist. But when she was at the hospital, they decided that after the hospital setting, like with most stroke victims, you have to go to a rehab facility right after. So as soon as she got discharged from the hospital setting, she went to a rehab facility where she spent about a month and a half. So during the first month and a half, she worked every week with the occupational therapist and physical therapist with getting her strength up. And the difference between this rehab facility versus a hospital setting is that it's more focused on the rehab. So as opposed to the hospital setting where you're seeing a therapist maybe once a day, you're gonna see them a lot more frequently throughout the day, because this particular rehab is more focused on how to manage strokes and the recovery right after. So she worked extensively with them. She learned how to become more independent very slowly. She started using a walker, she learned how to use a cane, and she worked with the therapist and all of that to kind of get her sense of independence back. After that point, she ended up going discharged from home, and she got in something called home health. And home health is an agency where they send nurses, they send therapists to your home setting at your convenience, and they bring all of the care right to your home. So as she was at home, they spent the first week going over physical therapy, occupational therapy, doing lots of exercises such as range of motion, helping her brush her teeth, cooking, just daily acts of active living to kind of get her back to her normal baseline. Well, they helped her for the first month or so, where they sent someone about twice a week. After that, they slowed it down during the last half of the month, and they started sending occupational therapists and physical therapists only once a week. So she got the independence, and now the current plan for the family is to send her to an outpatient rehab facility where you could send patients to get additional support for the physical therapy and occupational therapy. So in a nutshell, that is my Lola story, and it kind of just shows a perspective on all the steps and what is expected right after. When it comes to rehabilitation therapy, there's lots of involved. It's a team effort, as I said in the previous episode. You have physicians involved, you have nurses, physical therapists, occupational therapists, you have speech therapists, you have all these different specialties involved, and the purpose of having all these different specialties and disciplinary people involved is that you want to be able to get that patient, you want to get your loved one to a normal baseline. Because for previous baseline without the deficits, you're carrying out a day regularly. But what you don't realize is that after you have a big stroke like my Lola, you have to work with a lot of therapy to get back to that normal baseline. So currently right now on a weekly basis, my Lola is working more with the therapy. She's doing her best with getting up from bed, becoming more independent, but it's very difficult for her and the family. And one of the biggest things I wanted to share was what are some tips and tricks on how to manage this appropriately while you're at the home setting. One of the things when I was talking to my auntie about the situation at home was you have to be very patient. When it comes to stroke therapies, a lot of the patients sometimes they will one day feel normal one day, and then the next day they will feel like they're tired, they're weak, they don't want to do anything. It's important to be supportive, to motivate, to motivate them to be the best person they could be, to motivate them to do as much activities as they can possible, but at the same time you don't want to push someone. This goes with anyone in the hospital setting too. You want to motivate, but you don't want to be too pushy. One of the biggest words that you have to understand is the word called empathy, which is the ability to put yourself in another person's shoes. Stroke victims, you have to realize it's not very easy for them to be doing these activities. You have to be empathetic, you have to be sympathetic especially as well. You have to put yourself in their shoes. You have to understand, how they're feeling, and every day, every morning of the day, you have to ask them, how are you feeling? At the same time, you want to encourage them based on that. If they're in a good mood, they say, I'm feeling really good, I want to do some therapies. Well, great, that's the time when you want to motivate them to do those extra therapies. But if there are some days when they're feeling like they're weak and they're tired, you don't want to be too pushy because it's just going to push them away and make them a lot more sad in the process. As I mentioned before, one of the biggest things that can happen after a stroke is depression. So with depression, you just want to be as nice, you want to be as comforting, and you want to be as supportive as possible, especially throughout this process as well. It's also important too, you have to pay close attention to the cues. Lola, while she didn't have any major deficits, she only suffered a left-sided neglect deficit. And with left-sided neglect, she had weakness, she had lack of strength on the left side of her face and her body. So it made it very difficult for her to get up and walk. So I want to show a quick clip right here of my Lola working with 3 therapists alone just to walk, and you'll kind of see how difficult it is for her to walk. So when you're looking at that video, guys, as you can see, they're taking their time, they're encouraging her, and also motivating her. They're not rushing her to go through that activity, but they're taking an appropriate pace to get her up and walking, and that's the type of activity that you want to be. Another therapy that you want to do is where you want to work on fine motor skills. Sometimes with people with stroke victims, they have a difficult time moving around their hands, they have a difficult time with range of motion exercises, and so you want to also be able to focus on their hand-eye coordination. In the second clip that I want to show you guys, here is a video of my Lola. She's doing some arts and crafts where she's kind of like sewing on a little board, a little cute board with different strings involved, and that's helping her with her hand-eye coordination. So 2 activities that I just showed you, the walking and the hand-eye coordination, it really helps with stroke victims. As I said again, you also want to pay close attention to the side that's affected. So whether it be right side or left side, with my Lola, she had the left side in neglect. So it's very important that you pay close attention to your loved ones, especially when they're falling weak and they're feeling dizzy, because you want to, above all, prevent a fall from happening. I know for a fact, and this is an example of the importance of being mindful and being watchful. My aunt was just telling me that, when she was at the rehab facility, there was 2 instances in which she failed due to poor communication, poor lack of documentation, and also just plain not paying close attention to what was on the board at the time. So on the board, it clearly said that my Lola was having left side and neglect, and he had to focus on the left side. Well, with that in mind, when therapists would go into the room, they completely ignored the fact that, she had that left-sided. They focused on the other side, which was the stronger side, and as a result, she fell 2 times. So it's very important that you pay close attention to what is the side of deficit, and also you have to pay close attention to your patient, what they need. She fell because she was trying to reach over for something and no one was there at the time to catch it. So if someone is not there 24 hours of surveillance, you just got to keep doing things like hourly rounding, in which you constantly check on the patient every 1 hour or so, just to make sure that they have everything that they need in front of them. They have their water, they have their cell phone, everything that they have, so they don't have to reach and accidentally tip over. And above all, guys, you really need to trust the process. When it comes to strokes, it is a process. You're not going to get back to your normal baseline right away, and you have to understand that from a patient aspect and also from a loved one's aspect as well. From a family's aspect, I know we have great intentions of, getting our loved ones up and running as quick and fast as possible, but it will take time. You kind of just have to pause, take a deep breath, and just take time. It's not going to happen in one day. It's not going to happen in a week, but it's going to be a process. It could take a couple of months. It could take a year or even 2 years, but you just want to be able to be patient and be encouraging as much as possible throughout the way. At the end of the day, it is a team effort. Like I said, you have different specialties, you have different loved ones, and it's important to communicate and talk to one another so complications such as falling and additional accidents such as strokes and other sorts of that don't happen in the future. What's most important, guys, is the education. If you have any questions, it's important to ask your healthcare professionals, especially if you're a loved one. You got to be able to ask questions, and you don't want to be afraid to do so as well. Hope you guys enjoyed this episode of Nursing and Flow. I hope I kind of shed some light more on the perspective on what to expect after a hospital discharge. And I hope this resource helps you guys understand what are some important tips and tricks that I need to keep in mind when taking care of a loved one who had just undergone a stroke. If you guys enjoyed this episode, please like, subscribe, and comment below if you have any additional suggestions on how to manage stroke victims at the home setting and the hospital setting as well, if you wanted to add. And I hope you guys enjoy future content that I'll provide for you. Thank you for watching, guys. Take care.
Bustling through the bears that try to contain me. Moving on up, making moves of money endlessly. How you think I got this name? C Money, it's my specialty.